Okay, good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your face in the video. As a reminder, another reminder is that after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. We have placed the link in the chat box. Another reminder, obtaining 50 letter certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Okay, ready? All set? One, one, two, one, two, three. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 group of courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. So by May 15, 2024, we will be reaching the 3rd year already. My pep talk today is entitled Clinical Diagnostic Algorithm for Common Surface Lumps. The empowerment objective is for the lay people to have an essential understanding of the clinical diagnostic algorithm for common surface lumps in their health management. The contents of this pep talk will be the following. What is a surface lump? How common is a surface lump? What is the importance of knowing how to manage a surface lump? What is a clinical diagnostic algorithm? What is the importance of knowing the clinical diagnostic algorithm of surface lumps? And what are the clinical diagnostic algorithms for the common surface lumps? So this will be the topics for today. A disclaimer is that this pep talk contains my thoughts, perceptions, opinions, and recommendations culled from personal experiences and also from other professionals. Let's start with the first topic. What is a surface lump? When you say surface, nasa ibabaw lang. Okay? Lump means a bukol. Okay? So, bukol sa ibabaw ng katawan. Okay? So, a surface lump is a mass or a bukol that is located on the surface of the body, one that can be touched, palpated, and evaluated by the examining fingers of a person, at least, if not seen by the naked eye. Sinabi ko at least by the examining fingers because some surface lumps cannot be seen, but they can be touched or palpated. But there are some surface lumps which can be both seen and touched. So pag nakikita at nahahawakan, nahihipo, mas reliable ang findings. Okay? Compared to the surface lumps that cannot be seen but can be touched. Okay? Although palpation is still more informative when it comes to diagnosis. So mas maganda kinakapa kaysa tinitingnan lang. Pero mas maganda kung nakikita yung bukol at nahawakan. So pag nakikita at nahawakan, napag-palpate, siguradong andun siya. So meron siya. Examples of surface lumps will be the following. Lumps on the skin and soft tissue. Soft tissue yung ibig sabihin ng soft tissue sa ilalim ng balat pero hindi kasama yung mga buto. Yung muscles, mga taba, kasama yon. Soft tissue. Okay. Then lumps on the scalp, face, and mouth. Lump on the thyroid gland and neck. The thyroid gland usually located sa gitna ng leeg. Neck is buong neck usually, but it refers to the side of the neck of the area. Lumps on the wall of the trunk and abdomen. So pinag-usapan dito yung hindi yung sa loob ng tiyan, no? Okay. So we're talking about lumps on the wall, no? Okay, yung mga liver, kung isa nakakapa rin yung liver tumor, pero we're not talking about those things, no? Okay. Nakakapa rin yung mga colon, intestine, pag malaking-malaki na, makakapa yun, no? So but when we talk about surface lumps, we're talking about yung mga lumps sa trunk, sa abdomen, doon sa wall lang. Okay, sa wall. Then lumps on the extremities, lumps on the anus, sa puwet, lumps on the breast. So these are the more common areas that surface lumps can be palpated. Examples of surface lumps. So ito, sa balat ito, skin. Ito, medyo malalim, no? Pero mukhang na-involve na yung balat, pero mas malalim yung bukol. So we call that soft tissue. Soft tissue. Pag meron ka ng break in the skin, now most likely it's a skin lump. Pero kung buo pa yung balat, pero may bukol sa ilalim ng balat, we call that soft tissue lump. Ito, scalp ito. Okay, scalp sa batok. Okay, so there's a tumor on the scalp. And then ito yung tenga. So ito, a tumor on the face. Okay. So kitang-kita at pwedeng hawakan at pwedeng kapain. Ito naman, nakikita yung isang tumor dito sa ilalim ng dila, no? Or floor of the mouth. Okay. So we call this area floor of the mouth, no? So may bukol dito, kitang-kita at pwedeng kapain. Then, ito, sa puwet ito, puwet, hemorrhoids. Nakikita yung hemorrhoids o kumisan, baka mga cancer ito, pwede rin. No? Pero most likely hemorrhoids ito. So, surface lumps, kasama yung anus pag nakikita. No? Okay? At pwedeng hawakan, at pwedeng kapain. No? And then, sa leeg naman, so yung sa gitna, usually thyroid. So, pwedeng makita at makapa. Kung minsan, hindi pa ganong kalaki at hindi pa nakikita, pero pwedeng kapain. No? That's why I said surface lumps, at least nakakapa. Mas maganda kung nakikita rin. Kung nakikita at nakakapa, ibig sabihin, significantly malaki na siya. No? And then, ito naman, sa side of the neck, okay, isang area, pwedeng dito, pwede dito sa baba, pwede dito sa likod ng konti, sa likod ng tenga. Okay. So, surface lumps on the neck. No? Ito naman, example will be, as I said, isang lump, surface lump dun sa chest wall, sa dibdib. No? Sa ibabaw ng ribs, sa ibabaw ng yung tinatawag na breastbone or sternum. Okay. So, hindi kasama yung lung, bukod sa lung. Malalim na yon. No? So, pero kung nasa ibabaw lang ng chest, we call that surface lumps on the chest wall. Ito naman, ito yung nipple, and then ito yung navel. So, ito makikita mo, most likely this is nasa abdominal wall. No? Okay. So, usually, pag ganun naka-prominent, usually baka abdominal wall yon. Pero kung minsan, pwede din galing sa loob ng tiyan, loob ng abdomen. Pwedeng stomach, yung malaking-malaki na, advanced na, makikita rin. No? Okay. But we don't call tumors of the stomach, intestine, liver, surface lumps. We don't call them that way. No? Yung mga nasa wall lang ng abdomen, we call that surface lumps. Surface lumps, again, sa kamay, yan, dito. Pwede dito, pwede dyan, pwede dyan. Ito nakikita na at nakakapa. Surface lumps on the foot. Okay. Pwedeng nakikita, pwedeng hindi. No? Okay. So, foot, hands, pwede din sa arms, sa legs, no? Sa thigh, pwede rin. No? Okay. Basta yung nakikita at nakakapa. Okay. Kung di nakikita, pero kung nakakapa, surface lumps pa rin siya. Dito naman, surface lumps on the chest, on the breast. Okay. Ganon. Nakakapa. No? Okay. So, how common is the surface lumps? So, with the examples that I gave you, you can imagine that it is very common to the point that we can say it is very common. So probably I can say that in the whole lifetime of a person, siguradong may experience siya na kahit na, at least isang episode ng surface lumps. Okay? So that's why it's very important to know how to handle surface lumps. It's very common because all these parts of the human body, which practically cover the whole areas of the body, okay, can give rise to a surface lumps. Okay. Skin and soft tissue, scalp, face and mouth, thyroid sa neck, and then wall of the trunk and abdomen, extremities, anus, breast. Practically, lahat ng area sa katawan pwedeng yung mga nakikita na on the surface, pwedeng tamaan ng bukol. So what is the importance of knowing how to manage a surface lumps? So not only are surface lumps very common, that's what makes it important to know how to manage it. They cause instant anxiety once a surface lump is discovered. So the moment you feel that you have a buccal dito sa katawan mo, sa ibabaw, no? Right away, mag-iisip na kayo o mag-worry na kayo. Ay, nako, meron akong ano. Baka cancer na ito. Diba? Usually, ganun yung mga reaction. Basta bukol, pag ang pinag-uusapan, cancer o hindi. No? Okay. So for all surface lumps, the first question to answer is, what is it? So yung tatanong nyo, ano siya? At nag-worry na tayo kung ano kaya siya. So while trying to get to the diagnosis, one cannot help but think and worry that the surface lumps have the possibility of being cancer. Okay? And to allay and shorten the instant anxiety, because the surface lumps may not be cancer after all, fortunately, as may awa rin ng Diyos, majority of surface lumps are not cancer. Pero tayo, pag meron tayong surface lump, nagwo-worry tayo because of the possibility of cancer at hindi natin alam kung cancer ba ito o hindi. So for this reason, all lay people should be empowered to know the cues and yung mga signals for non-cancers beside knowing the cues for cancers. Okay. So this is the main reason for this pep talk, to allay and shorten the instant anxiety. The moment you have a lump, mag-iisip na kayo, pero kung alam niyo kung how to diagnose it, kung hindi naman siya cancer, baka mabawasan yung ano niyo, yung takot niyo. Pero kung cancer, at least it will help you decide what to do. So the title of my talk is Clinical Diagnostic Algorithm for Common Surface Lumps. So ano yung ibig sabihin ng clinical diagnostic algorithm? Because a surface lumps can be cancer or not cancer, lay people should be empowered to know the cues for cancer and not cancer based on looking and palpating. The clinical diagnostic algorithm will guide the lay people on how to recognize cancer and not cancer in surface lumps just based on looking and palpating. That's what is meant by clinical. So clinical diagnostic algorithm, there's the word clinical. When you say clinical, it's just based on, in terms of surface labs, in terms of looking and palpating. Wala mo na yung mga diagnostic tests like ultrasound, like x-ray, gano'n. No? So hindi mo pa kailangan yon. So titingnan lang, kakapain lang, and then I will teach you how to make a diagnosis kahit na yung unang suspetsa lang. No? And clinical diagnostic algorithm of surface labs is the process, how the procedure of making a diagnosis. It's based mainly on recognition of patterns or cues for cancer or not cancer. Ito yung pinaka-common basis. Dapat malaman natin ano yung pattern ng isang bukol na will tell you that it's cancer or not cancer. Okay. So basically, that's the algorithm that I will be teaching you. And what is the importance of knowing the clinical diagnostic algorithm? So that fear can be allayed as soon as possible once a surface lump appears or develops, if the lay people knows the cues for cancer and not cancer. Kung alam niyo yung cues, then yung fear ma-allay kagad, na mawawala. Okay? Now, so that the lay people knows when to consult a physician. Kung may suspect siya cancer, punta na sa doktor. Early consult with a physician may be promoted, and then early diagnosis and treatment may be promoted. Kasi we have seen a lot of lay people may surface labs, hindi nila alam, o tumisan, hindi nila alam, o hindi naman masakit, binabaliwala, akala nila kung walang sakit, hindi siya masama, pero kadalasan, pag hindi masakit, may mas malaking chance na masama, na mga ganon, na. So they have to be empowered, na. So what are the clinical diagnostic algorithms for common surface labs? So ito na yung the gist, the pinaka-essential lessons here. Ano yung mga clinical diagnostic algorithms? So first of all, we have to know the definition of surface labs. Okay? So kami na define na natin. The surface labs is a mass or a bukol that is located on the surface of the body, hindi sa ilalim, hindi sa stomach. One that can be touched, palpated, and evaluated by the examining fingers at least, if not seen by the naked eye. So then the foremost question to us, pag nakita niyo yung surface lump, just based on palpation at least, is there a surface lump or not? So yan ang tatanungin. No? Mayroon kayong parang may nakapang bukol, tatanungin nyo, talagang meron ba ako o wala? Okay. So remember this definition that I told you. Okay. And surface lumps, to differentiate, kasi makakala nyo yung mga matitigas lang, yung mga kalyo surface lumps na. Hindi surface lumps yung mga kalyo, iba yun. No? Okay. Yung mga surface lumps, usually oval, three-dimensional siya, no? Oval or round. No? Hindi yung pahaba. No? Usually thickening yun. No? Or kumisan yung mga medyo malaki yung muscle, akala niya bukol, pero enlargement lang. No? Malaki lang. No? Okay. So, Once you think that you have a surface lump, you make sure that meron ba talaga o wala. Okay, that's the first question that you have to ask. So make sure to differentiate yung makapal and saka yung mga enlargement, yung malalaki lang, yung isang balat, isang organ, isang muscle, gano'n. Iba yung sa surface lumps. Now, if the answer is yes, kung talagang meron, there is a surface lump, the next question to answer is saan siya located? On which part of the body is the surface lumps? Is it on the head, scalp, face, mouth, neck, trunk, extremities, anus, or breast? So, pag na-localize na ninyo yan, meron na kayong initial diagnosis. Okay? When I say initial, probably 50% ando na yung diagnosis mo. No? So, sabihin natin, kung may bukol ka sa head, sa lump, sabihin mo, I have a surface lump on the head. I have a surface lump on the face. I have a surface lump on the neck, on the trunk, okay, chest or abdominal wall, on the extremities, specify lang kung sa upper or lower, or hand, foot, arms, forearms, etc. And then lump on the anus and lump on the breast. So yan ang first step. No? May bukol ako, nasaan siya? And the next step would be, okay, after the location, the next step would be to know whether it's cancer or not. Okay, so but before we go to that, kung cancer or not, okay, I'll just illustrate this again. So if you see a lump here sa may scalp, ang diagnosis mo, I have a lump on the scalp. Kung meron dito sa mukha, I have a lump on the face. Okay? Huwag niyo kagad sasabihin may cyst tayo. Basta bukol lang. I have a bukol. Iba yung connotation ng cyst. Okay? Basta gamitin lang yung the word bukol. May bukol, may mass, may lump. Okay? And then may bukol sa breast kung may nakakapa kayo, kung sigurado kayo. Okay? And then after that, pag na-localize na ninyo, the next thing to do is, okay, before deciding whether it's cancer or not, may one step pa pala dito that you have to, kasi surface ito, may mga buto pa yan, mga buto na no? So, papalpate nyo kung talagang, whether it's arising from the bone or not. Yan muna gagawin before you parang nilolocalize mo pa rin kung saan galing. No? So, if it's bony hard, talagang pag kinapan yung panga ninyo, gano'ng katigas, bony hard, bone lumps siya. No? Okay. So kung bone lumps, example will be lump on the skull, okay. Lumps on the facial bones or tumors, lumps on the tumors on the ribs or the chest, and then extremity bone tumors. So these are examples. Kung may nakapa kayong surface lumps, yung kapangkapa at talagang matigas na parang buto, buto yun. Tumor sa buto yun. So depende kung nasaan lugar, is it on the skull, the face, or the chest, or the lump. Now, if it's not bony hard, hindi man kasing tigas ng buto, most likely it is skin, either skin or soft tissue, soft organ lumps such as the breast, lymph nodes, etc. So example, yung breast, we don't call that a bone, di ba? Okay, usually wala kang makakapa doon unless may nakakapa kang bukol doon sa ribs. Iba yun. So ribs yun, no? So, if not a bone lump, it could either be a skin lump or soft tissue or a soft tissue organ. Okay, tatlo yun, no? Skin, soft tissue, or soft organ lump. Okay, example of soft organ lump would be the thyroid lump, parotid lump, breast lump, or lymph nodes. Example of surface lumps again, so you have skin lump, soft tissue lump, lymph node, usually na side of the neck, ito lymph nodes siya. Ito parotid, usually nasa baba na, malapit sa tenga. Okay, and then ito thyroid. So these are examples of soft organ lump. Okay, to differentiate it from yung mga soft tissue tumors. Soft tissue tumors include yung mga nasa taba, sa ilalim ng balat, yung mga ugat, no? Ganon. So once you have localized yung location as well as the type of lump, whether it's bone or not bone, then the next question to decide is cancer ba ito o hindi. So the simplest algorithm that I will be imparting to you or teach you will be, hahanapin niyo muna signs of inflammation. I-expound ko dito mamaya, pero sabihin ko lang sa inyo algorithm. Ang unang gagawin, maghahanap kayo ng signs of inflammation. Kung merong inflammation positive, yun na, part of the diagnosis ninyo. No? So inflammatory surface lumps, yun. Yan ang diagnosis. Pero kung walang signs of inflammation, so negative siya, wala, no? Negative, no? Okay. So the next thing to decide, is it cancer or not cancer? When you say malignancy, cancer. No? Signs of benignity means not cancer. Okay? So, ang gagawin niyo muna, kung walang signs of inflammation, to decide whether it's a cancer surface lump or not, ang hahanapin niyo muna are signs of cancer. No? Yes, i-expound kasi ano yung mga signs of cancer. No? Then kung wala, sasabihin niyo, ay, benign pala. No? Okay. Pero kung may nakita kayong signs of cancer, most likely, magsuspect na kayo cancer. Di ba? Kung meron. No? Kahit na isang sign lang. I will tell you the signs later on. No? Kung wala namang signs of cancer, walang signs of inflammation, most likely, benign siya. So, makakahinga kayo ng konti. Di ba? Okay. But we still have to verify this. So, ano yung signs of inflammation? Signs of inflammation would include pus, nana. Kung may nana, 99.9% yun na yun. Yung bukol na yun, may inflammation or infection yun. No? So, kung wala pang nana, parang yung pigsa, wala pang nana pumuputok. No? So, hindi niyo nakikita yung nana. Pero may makikita kayong mapupula, redness. No? Again, you will now suspect, baka, ano siya, inflammation lang. Okay. Kung wala pang redness, minsan yung mga pigsa, before it reaches the stage na mapula, may pus, matigas, ay masakit, di ba? At mainit. No? So once you have warm, mainit, at medyo masakit, you suspect inflammation already. No? So any one of these kung present, no, will make you suspect inflammatory or infection slumps. Okay? So this is the best thing to have, no? Among the three categories of surface lumps: inflammatory, malignancy, benign. No? This is probably the best one to have kasi madaling gamutin. No? Okay. So, but when you have inflammatory lump, so don't worry, it's not cancer. Okay. So, kung walang inflammatory signs, okay, bakit ito yung inuuna ko? Signs of inflammation. Kasi madaling hanapin eh. Na? Okay. Madaling hanapin. So by elimination, mag-eliminate nyo itong signs of inflammation, signs of malignancy, benignity, na mas madaling eliminate yung signs of inflammation kung wala. Na? O kung meron, you just hold on to that diagnosis. No? Example, ito, may nana. No? May surface lumps, tapos may nakita kayo, yun, madilaw, maputi, no? Okay, nana siya. So, ang diagnosis mo, abscess na to. May nana, abscess, no? So, hindi siya cancer. So, makakahinga kayo na it's not cancer. So, ito naman, ganun din. Ito, nasa breast, no? Breast. Pag mapula, okay? Mapula is a very reliable sign already. Mapula, no? And then, kung masakit at mainit, all the more, ano yan, breast abscess. Okay. So after the signs of inflammation, as I said, next step is to look for signs of malignancy or cancer. Ito yung mga signs of cancer. So isipin na lang ninyo anong behavior ng cancer. We know that the cancer usually nag-invade ng adjacent tissues, no? Or nag-spread sa ibang lugar. No? So signs of invasion to adjacent tissues, kung nakadikit yung bukol sa balat, sa muscles, sa bone, no? At may may break sa skin, may ulcerations, at hindi siya gumagalaw, fixed, kasi nakadikit sa adjacent tissues, then you suspect cancer. Now, kung merong lymph nodes sa malapit dun sa areas na yon, and also kung merong siyang another bukol sa malayo, no? Let's say sa lungs, sa bones, etc., then you suspect cancer. Okay. So the easiest thing to remember for signs of cancer, tandaan na lang yung signs of invasion, signs of spread. Okay. So kung may signs of malignancy, kahit isa lang, may ulceration, kahit wala pang fixation, may ulceration, cancer na. Kung may lymph nodes, no? Okay. Although not all tumors will have lymph nodes, no? At not all lymph nodes na may surface lumps, hindi lahat ay cancer, no? So, pero kadalasan, kung meron kang, let's say, breast tumor, pagkatapos may lymph nodes sa axilla, chances are you are dealing with cancer already. No? Okay. So, kung walang signs of cancer, pwede ka tentatively conclude, most likely it's benign. Makakahinga ka ng konti. No? Okay. But you still have to make sure that it's benign. So, ito yung magandang clue, signs for benignity. Okay. Cystic lump. Kung yung bukol ay parang may fluid sa loob, malamang hindi siya cancer. Okay? Not 100%, pero malaking chance na hindi siya cancer. So ito, example ito. Yun. Kinain na yung balat. So ito yung skin tumors. Kinain na. No? So invasion siya. Ulcerations. No? Okay. So this is skin cancer. Ito naman, may thyroid tumor, okay? Ito, tinutulak na yung trachea, ito, and then ito yung mga kulani, marami, no? So that's a sign of spread. So this is thyroid cancer. No? So ganon. So to repeat, surface lump, kung meron, location, and then after the location, check whether it's coming from the bone or not from the bone, and then after that, make a diagnosis or suspect, educated guess na lang, whether it's cancer or not, based on the algorithm that I gave you. Signs of malignancy, signs of inflammation muna, signs of malignancy, and signs of benignity. Ito, no? Okay, tandaan na lang niyo ito. Look for signs of inflammation, signs of malignancy, signs of benignity. Tatlong 3 steps lang naman yan. Now, for the more specific ones, medyo mahirap lang ito, but I'll just go through this quickly para may idea lang kayo. Later on, probably we'll have some sharing, some exercises na actual. No? Okay. So kung may cervical lymph nodes means may kulani. Kulani dito sa leeg. Cervical means leeg. No? So kung positive, kung meron, okay, 4 lang ipinag-iisipan dito. No? Metastatic cancer, may pinanggagalingan, or non-specific inflammation, usually pag may sipon ubo, lumalaki. No? Lymphoma, it's another type of cancer. No? So cancer of the lymph nodes, no? Pero primary siya, hindi siya metastatic. Metastatic is secondary because may pinanggagalingan. No? Okay. Example dito, kung metastatic ito, baka may bukol siya sa bibig, na pumunta doon, o meron siyang bukol sa tenga at pumunta siya doon. So, metastatic yon, no? Okay. So, lymphoma, usually maraming bukol-bukol, marami yan, usually multiple lymph nodes. Okay. So, the other thing which is not quite common but still present will be TB. TB, no? So, usually may nana, may break in the skin, gano'n. Pero, to say that you have TB, that i-roll out muna itong tatlo, no? Okay. So, ang pinaka-common dito will be the non-specific inflammatory. Kadalasan kasi may ubot-sipon tayo, usually lumalaki yung mga kulani, but you don't have to worry, usually nawawala sila. Okay. Okay. Kung hindi naman sila nawawala, usually hindi naman lumalaki, no? Okay. So, the next most common will be metastatic na, no? Lymphoma is not very common, not so common. TB, as I said, nowadays is not very common. Dati-dati very common siya. Now, kung skin and soft tissue tumor masses, ganun din, Okay? So you look for yung mga border, okay? Kung may signs of malignancy, signs of inflammation, signs of malignancy, signs of benignity, yun yung gamitin ninyo. A special mention here, pag meron kang tumor na maitim, black, nagsususpect siya kayo ng melanoma, baka skin melanoma yon, cancer yon. Okay. The other soft tissue tumors, which I think we have discussed this for those who have been attending, may mga epidermal cysts, lipoma, fibroma, etc. So ito, this one, parang ito, may ulceration sa skin, kinakain na yung paligid, ini-invade. So this is skin cancer. Okay, may dalawang types of skin cancer. This so-called squamous, saka basal cell carcinoma. And then this is the third type. Usually, as I said, pag itim, nakakatakot yung itim na skin lesion, baka melanoma. Melanoma. Ito yung pinakamasamang cancer. Compared to yung tinatawag na squamous and basal cell carcinoma. Ito naman, may surface lumps, may mata, may punctum. Okay? Ito yung epidermal cyst. We have discussed this before. Okay? Epidermal cyst, pag pinisil mo ito, marami mga dead skin lalabas yan dyan. Ito, lipoma naman, this is another tumor. A tumor arising from the fat. Usually soft, usually gumagalaw. Okay, facial mask, kung may bukol sa mukha, again, check nyo kung nasaan lugar, tapos kung bony or not bony hard. Kasi, and then i-check mo rin kung node siya or hindi siya lymph node or skin or soft tissue. Ito, pag bony hard, nasa panga, usually mandibular tumor ang tawag doon. Okay. Tumor sa panga. So an x-ray is needed for that. Okay. And then, dito naman, so you have a lesion, pangit ang lesion, parang kinakain na, parang ini-invade na yung surrounding tissue. So you suspect cancer here. Cancer of the floor of the mouth. Pag ganun itsura. Kung smooth na smooth siya, wala siyang signs of invasion, most likely benign siya. Ito naman, may bukol dito sa panga. Sa pagkapa, hindi matigas, so hindi siya bone. So merong isang area dito, may isang soft tissue organ, yung tinatawag na salivary gland, minor, submandibular gland. Yan ang tumor coming from that organ. Submandibular gland tumor. Okay, sa thyroid, ganun din. Thyroid, you look for signs of inflammation. Kung wala, then you look for signs of malignancy. Kung nakadikit, hindi gumagalaw, at may lymph nodes, may distant mass, then you suspect malignancy. Kung wala ito, then you can say that most likely it's benign. So by elimination lang, 1, 2, 3. Ganun din sa breast mass, ganun din. Hanapin nyo inflammation. Kung may signs of inflammation, breast infection or inflammation. Kung wala, you try to look for signs of cancer. Kung walang signs of cancer, then you settle for most likely it's benign. Okay. Okay. So summary and takeaway for this lecture. What is the surface lump? How common is a surface lump? What is the importance of knowing how to manage a surface lump? What is a clinical diagnostic algorithm? What is the importance of knowing the clinical diagnostic algorithm of surface lumps, and what are the clinical algorithms of the common surface lumps? So the importance of knowing the clinical diagnostic algorithms, yung tatlo, yung signs of pinaka-basic, signs of inflammation, signs of malignancy, signs of benignity. Okay? So that just try to remember that algorithm, yung basic, so that fear can be allayed as soon as possible once a surface lump appears or develops. Okay. Lay people knows when to consult a physician. Early consult with a physician may be promoted. Early diagnosis or treatment may be promoted. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on clinical diagnostic lumps or clinical diagnostic algorithm for common surface lumps. Knowledge is power. It gives power. Use the four Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on clinical diagnostic algorithms for common surface labs in your health management. So with that, I end my pep talk this afternoon. I hope I have empowered you to have an essential understanding of the clinical diagnostic algorithm for common surface labs in your health management. So before we go to the question and answer portion, reminder, please take the OLETE. 50 OLETE certificates will entitle you to one voucher. We're now on our 126. If you are closely following taking the OLETE, dapat meron na kayo tatlo. Pangatlo na, malapit na maging tatlo. Kasi 50 for one. Okay? And then feedback, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the QA and interactions. Okay. Set. Ready. 1, 2, 3. Okay. So the floor is now open for questions, comments, suggestions, and free consultation. Short free consultation.
Doc, may tanong po ako.
Sito, si Kat. Okay.
Tanong ko lang po, yun sa pinsan ko, na thyroidectomy na siya, tapos radio-iodine na. Bumalik pa rin po, yung nag-thyroglobin siya, bumabalik pa rin daw po yung cancer niya. Possible po yun?
Ang tanong kung possible, you're talking about cancer, although kahit na hindi siya cancer, yung mga sakit ng tao sa mundo, kumisan bumabalik. Pero cancer is easily, kasi at the moment we still don't talk about cure for cancer, no? So we always consider that cancer is a chronic disease, pwedeng umulit, no? Pwedeng hindi din, no? So ang tanong mo kung possible, no? Kasi thyroid cancer, no? Okay.
I mean, ano na siya, radio-iodine, talagang bumabalik pa rin po. Walang 100% na kasiguraduhan yung...
Yeah, walang 100% kasiguruhan yung mga gamutan sa cancer, na lahat ng ano. Pero ang pinaka the best treatment modality so far is still surgery, na? Kasi may nakikita tayong mga track records na after inoperahan, kahit na walang radioactive iodine, kung di naman kailangan, hindi naman bumabalik, no? Okay. So,
Okay, thank you po.
ang sagot sa tanong mo, posible. Number one, posibleng bumalik yung mga cancer kahit na anumang gamutan. Kahit na anumang gamutan. No? Only time will tell. No? So sige, yung nag-attend tayo ng Cancer Crusaders, you have seen yung mga naka 40 years na, may mga 40 years. Okay. So I would say that most likely hindi na siya babalik kasi 40 years na based on track records. Pero there's still a possibility it might recur. 0.0000001% na lang. Huh? Okay.
Okay,
Pero
thank you po.
yung mga 10 years, mas pwede pang bumalik. Pero mga, let's say, mga point, kung 10 years, baka 1%. Ganon. Na? Okay. Okay?
Okay po.
Importante yung check-up mo. Cut, ha? Cut. Yung sa'yo, microcalcinoma sa'yo, di ba? Maliit, no? magandang chance yun, no? Pero importante pa rin yung check-up, no? Okay.
Okay po, Doc.
Any more questions? Wala? Lorly. Iba yung pangalan mo ngayon. Lorly. Picture mo nga.
Doc.
Patingin picture. Ikaw ba si Lorly? O Lorlier ka ngayon? Lord, may mga, aside from your breast, meron kang ibang bukol sa katawan in the past? Meron kang mga bukol?
Wala na.
Dati? I suppose meron. Ako meron eh. Wala kang mga bukol-bukol sa katawan na wala at andyan pa? Aside from your breast cancer, yung tinanggal ko na yung breast cancer mo no? Pero yung mga, wala kang mga bukol dyan sa ulo, sa balat, sa ano. Hello? Hello? Nawala. Walang signal, Lorly? How about others? Ayan, bumalik na. Lordy, nakabalik ka na. Unmute. Unmute yourself. Okay. Sige.
Kuya ko po pala, Doc. Naalala ko yung
Anong kuya mo?
bukol ko.
Ha?
Skull.
Ha?
Ano siya, Doc? Lumaki siya, Doc. Yung nawala yung signal.
Choppy ang dating. Choppy ba ang dating sa inyo?
Opo, medyo nawala, Doc.
Oh. Wow, wala. Anong tanong mo? Yung kuya mo?
Yung kuya ko po, Doc.
Okay, balikan na lang kita mamaya. Sino? Sige, any other, Phoebe, may bukol ka dyan? Phoebe? Unmute. Unmute na. Tanggal. Ayan.
Mayroon po dito sa tito.
Okay, sige. Kwento mo lang. Sige.
Pero matigas naman siya eh. At saka hindi naman siyang nangi-istorbo. Ganon. Natingnan nyo na po ito noon eh. Tapos diagnose ba yun? Pero sabi mo okay naman.
Pina-x-ray?
Oo, opo. Sabi mo okay naman, walang problema.
Okay.
Pero hanggang ngayon nandyan pa rin.
Okay, kailan mo napansin? Yan? Unang-una. Yung umpisa.
Mga 4 years na.
4 years
ago.
na. 4 years ago. So, nung pumunta ka sa akin 4 years ago na yan?
Yes, nung nagpa-check up ng yung laging pag-check up noon before pandemic.
Before the pandemic. Sige. Si Phoebe, may nakapa siyang bukol dito sa ulo.
Dito sa left.
So, ang unang diagnosis is may surface lump sa ulo. Okay?
Opo.
So, ang next step is kakapain natin, di ba? So, pag kakapain natin, anong yung parang buto, kasing tigas ng buto?
Ganon po.
Okay,
parang
kung kasing tigas ng buto, ano yun? Yung bukol na yun galing dun sa skull. Anong skull sa Tagalog? Anong skull sa Tagalog? Bungo. Di ba? Bungo. Iba yung scalp. Yung scalp ay balat. No? Okay?
Yes po.
Yung bungo, yun, buto yun. No? So, kaya yung ginawa ko sa iyo, kinapako ko na, nakapa ko na matigas, so buto. No?
Yes po.
So, kung
Pero
buto,
ni-send mo rin akong ano ba yung tawag doon? Na inano siya. Pero okay naman sabi mo.
Ay,
Hindi.
anong ginawa ko? Anong ginawa ko?
Na-send ako doon sa diagnostic. Ano ba yung tawag doon? Na inano nila to.
In-x-ray ko, o tinusok ko.
Ay, hindi po. Yung pinaano lang doon, ano ba yung tawag doon? Sa yung inano lang nila to sa may diagnostic test. Ano
Ultrasound?
ba yung tawag? Oo.
Ultrasound.
Ano ba yung tawag? Oo.
X-ray.
Hindi,
X-ray?
hindi X-ray. Yung parang inano lang nila. Ano ba yun? May nilagay silang ano dyan, liquid. Tapos ano lang. Hindi ko patandaan kung anong tawag doon.
Ultrasound.
Ultrasound.
Okay. So kung hindi tayo sigurado kung buto siya galing sa buto, no? Or kaya galing sa ibabaw ng buto, pwede nating pa-ultrasound, no? Okay?
Napa-ultrasound na, tapos nung ni-reading ko, okay naman daw, wala nang problema. Hindi naman kailangan tanggalin, basta normal lang siya na ganun.
Okay. So yan dinedemo ko lang yung application tinuro ko ngayon, di ba? May
Yes.
nakapaka doon. So nasa ulo, number 2, titingnan mo kung galing doon sa bungo mo o kaya doon sa ibabaw, no? Kung di tayo
Yes.
sigurado, pwede tayong gumawa ng test, di ba? Kung
Yes.
may suspecha tayo galing sa bungo, sa skull, X-ray ang dapat. Yung X-ray maganda sa mga buto, no? Okay?
Yes.
Pag hindi sa buto, usually mga ultrasound pwede, no?
Yes.
So lumabas na yung results, no? May diagnosis na tayo. So benign siya.
Benign.
Hindi siya cancer, kaya pwedeng obserbahan lang, no? Okay.
Andyan pa rin siya, pero wala namang sabi na sumasakit o ano. Basta andyan lang siya.
Baka buto yan. Buto?
Yes. Kaya buto siguro. Matigas siya eh.
Yeah, matigas buto. So, yung tinatawag na exostosis, na kumapal lang yung buto, kung minsan pag tumatanda na tayo, kumakapal. No? Ganon. Okay?
Yes.
Sige, thank you for sharing that experience. Okay?
Thank
Who
you.
wants to share other experience aside from breast? Pearl, meron kang mga bukol-bukol dyan na experience? Perla? Yan, sige.
Dito sa daliri,
Saan?
parang dito. Ito
Asan?
yan, no?
Video.
Nakikita nyo, doktor. Pati ko.
Hindi, nawala yung video mo.
Your video is stop.
Nawala yung video mo. Yan. Saan? Mute. Unmute naman. Unmute. Unmute. Ayan.
Ayan.
Okay. Good. Saan?
Ito, doktor, itong sa daliri ko, di ba yung parang bungokol, parang lumps from bone, ito siguro, ito. Nakikita niyo,
matigas?
dok?
Okay.
Oo, matigas, dok, ayan, no? Matigas.
Matigas.
Opo, matigas.
Patingin. Gitna mo sa camera.
Saan ba?
Gitna mo.
Ayan. Ito.
Okay. So meron kang bukol diyan, no? Okay.
Opo.
So may bukol ka sa daliri mo. So walang signs of inflammation. Wala. Tama?
Wala pa. Kakikita ko nga lang kanina umaga. Sabi, may bukol pala sa daliri ko. Sabi.
Sige. Okay, consultation na ngayon. I-apply mo yung tinuro ko ngayon sa iyo. So merong signs of inflammation, mapula?
Wala naman, doktor.
Okay. So wala. Ha?
Wala, parang ano lang, parang lumps lang na matigas, parang ito sa side niya parang matigas nga yan.
Matigas. So, buto siya. Galing sa
Opo,
buto. Okay?
opo.
Okay? So, kung sa buto, meron kang nasa
Ipapakonsult
daliri
ko ito,
dyan.
Dok.
So, huwag ka matakot. Wala namang signs of cancer naman siya.
Opo,
Okay?
opo,
So,
opo.
anong diagnosis natin? Arthritis yan.
Arthritis.
Oo.
Hindi
Okay?
naman sumasakit yung daliri ko, Doktor.
Ay, kuminsan yung arthritis, kung may mga time na hindi sumasakit, pero kuminsan may time na sasakit.
Nasasakit.
So,
Opo.
arthritis yan. Ito ako rin meron, no?
Ito pa yung doktor sa right din. Ayan yan pa
Yan nga.
Yan.
Arthritis yan.
Arthritis.
So, i-exercise, exercise, alalay mo lang, no?
Opo.
Okay? Ano lang, hanggang tumagal yung buhay mo. Okay?
So, hindi na kailangan ipa-check up, doktor. Ano na lang ito.
Hindi na exercise.
Exercise na lang.
Kaya nga kita kayo tinuturuan no, yung mga algorithm no? Para number one, di kayo matakot kagad, alam niyo how
to be sure nga, baka mamaya
no? Okay. To be sure,
Opo.
pwede. Pero at least meron kang initial na na mayroon kang knowledge na ano siya.
Opo.
Hindi ka
Opo.
Sa signs of inflammation, hahanapin, pinakamadali. No? Kung wala, signs of cancer. Okay? Kung walang signs of cancer, yan, medyo kampante tayo. Baka benign siya. No? Okay?
Opo. Opo.
Tandaan lang ho niyo, kasi ito hindi tinuturo yan sa mga, even sa mga doktor, hindi tinuturo yan eh. No? Okay. So, signs of inflammation, signs of cancer, signs of benignity. Basta yung parang may tubig, malamang cyst yun. Huwag kayo matakot. No? Pati yung pag sa ultrasound, pag nagpapa-ultrasound kayo, pag may naka-report na cystic, no? Sasabihin nila, benign siya. Diba? Okay.
Fibrocystic.
Okay.
Okay, Doc. Thank you po, Doc.
Any more? Rochelle? Any experience sharing?
Hi Doc, Rochelle here. Actually, magtatanong na po talaga ako.
Sige.
Meron po akong surface lump based on the discussion ha. Nag-start, nasa kilikili ko siya Doc. Sorry, hindi ko na mapakita. Kasi nasa kilikili ko po. It started Doc na parang pimple. So nung una, pag pinipisil ko siya, may lumalabas na parang puti na may amoy. Sorry po. Ganon siya, Doc. Tapos, so, ginagawa ko lang siya palagi, pinipisil ko lang siya until such time na wala ako nang mapisil, pero yung lump, ando doon pa rin po, until now. Parang nawala kasi yung butas niya, Doc, na pinaglalabasan nung puti before. Parang naging solid siya, Doc, na hindi ko na siya mapisil. I mean, hindi, pag pinipisil ko, wala na pong lumalabas, pero the lump is still there.
Okay, good. Okay, good. So, i-apply natin yung mga tinuro ko ngayon sa iyo, no? So, may nakapakang surface lump sa kilikili, no? Okay.
Opo.
Most likely, hindi naman buto siya, di ba? Soft tissue siya. Okay. So, ang next step to determine nasa ibabaw lang ng balat o mas malalim sa balat. Mapapabaw lang kasi napipisil mo, di ba?
Opo, nakaumbok talaga siya, Doc. So kita siya, apa siya.
Okay, nakaumbok. Okay, so most likely it's either skin or soft tissue, hindi lymph node. Okay? Kasi mas malalim yung lymph node, di ba? So, pag mababaw, skin or soft tissue.
Opo.
Sabi natin skin kasi sabi mo may butas, no? May butas sa skin, no? So kung ganon, okay, the other thing to consider is pag mapula siya, may inflammation. Pero wala, so you're thinking about malignancy or ano, no? Pero kung wala nang signs of malignancy, benign siya, di ba? So yung sabi mo, tanong ko lang, kung ilan ba yung bukol na yun? Isa lang?
Isa lang po, Doc.
Okay.
Yun lang po. Opo.
So isa lang, most likely, kasi Kasi very common dyan, yung mga, malapit na ba sa mga buhok-buhok na yan?
Opo, Doc. Yun.
So, kasi yung mga babae, di ba, majority, marami babae, di ba, kasi nag-aahit kayo, no, mga ganon, nagkakaroon ng infection doon sa hair roots, di ba? Okay. So, pwede yun, no? Pero kung usually multiple yon kung sa infection sa hair, no? Pero kung isa lang at discrete, ibig discrete, medyo isolated siya na isa, gano'ng kalaki? Mga 1 centimeter?
Maliit lang po siya, Doc, eh. Para po siyang pimple na lumaki. Yun yung size niya. Di ba meron po mga pimples na malalaki siya? Yun, parang ganun siya, Doc. Solid.
Solid siya. Solid.
Opo.
Okay. So, pwedeng epidermal cyst pa rin yan. Pwedeng epidermal cyst, may mata ka mo di ba?
Dati kasi, Doc, both na kilikili ko meron. Yung sa isa po, nawala eh. Since siya, dito sa may kanan ko po nakilikili, yun po yung hindi natanggal. Pareho lang po ng kaso sa Doc. Doon sa kabila, dati meron din pag pinipisel ko, may lumalabas na parang yon yung puti, may laman. Hanggang sa nawala siya, Doc. Ito naman sa kabila, hindi siya nawala. Ando doon pa rin po siya. Maliit lang siya, Doc. Parang pimple size. Yun, ganun.
Kasi kung kabilaan, malamang hair roots siya. Yung mga roots, yung mga hair na inflammation, pisil-pisil mo lang, na palabasin mo lang. So at least it's not cancer, you don't have to worry. Di ba? Okay. So ganun lang yon, mga hair roots lang yon. Na?
Thank you, Doc.
Here I can only give you general guidelines. Yung specific, yung mga detalya, I have to examine you. Diba?
Yes, Doc. Actually, Doc, I was planning to see you sana this December. Kaya nakita ko po yung post mo, parang 2 days na lang available ka na magki-clinic this December.
So, yeah.
Probably I'll schedule po early next year.
Yeah, okay. Ano bang schedule ang gusto mo?
Depende po kasi, Doc, kung kailan kayo may clinic.
May clinic ako next Tuesday, then the next Tuesday. May 2 clinics pa ako, di ba?
Opo, may 2 clinics ka pa this December, Doc. Kaya lang nataon na yung schedule mo kasi I handle payroll po kasi sa kumpanya. So medyo tight po yung schedule. Tapos
Anong available mo? Anong available mo?
Saturday sana, Doc, kasi doon ako walang pasok.
Sorry, hindi ako sa Saturday.
Opo nga, Doc, opo. Pero normally, Doc, meron kang Tuesday, Thursday, Saturdays pag nagki-clinic, no? Right? O mali?
Dati. After the pandemic, Tuesday na lang. Pag kung may, let's say, may holiday ng Tuesday, ina-adjust ko to Thursday.
Okay.
Pero once a week pa muna. Once a week.
Okay. Okay, Doc. Sige po, Doc. Mag-aano po ako. Mag-aabang po ulit ako ng schedule nyo sa Facebook para po magpapaschedule ako. Thank you so much.
Thursday, pwede ka?
Thursday po, I can file for a leave, Doc. Basta po maluwag yung schedule sa office.
Sige. I'll talk to you on Thursday.
Sige po, Doc. Sige po. Thank you so much, Doc.
Okay. Any more questions? Jeng, meron kang tanong, Jeng, aside from your thyroid breast, meron ka bang ibang bukol sa ibang katawan, surface lumps?
Wala naman.
Tama na yung dalawa, no?
Opo.
Ako, sabi ko sa'yo, in our whole lifetime, hindi niyo maiiwasan may bukol sa katawan. No? Siguradong magkakaroon.
Kuya ko naman po kasi, Doc, meron naman po siyang gout. Kaya yung bukol niya meron po sa likod ng paa, meron sa surface ng paa niya, ganun din. Kasi nga po, gawa ng gout. Kaya meron siyang bukol-bukol.
Yeah. Kaya nga.
Kasi na rin sa kamay. Paunti-unti nakikita niya meron na din.
Yeah. Kaya ako naisip na ibigay itong lecture Sabi ko, hindi natin maiiwasan yung mga bukol-bukol. No? Ang dami, iba-ibang klase, di ba? So just just follow the general algorithm para hindi kayo matakot kagad, no? Okay. At least may guide kayo, no? Okay. Okay. Sino pa ba? Si Phoebe. Oh, si Seni. Pumasok na si Seni. May tanong ka, Seni? May tanong ka, Seni?
Wala naman, pupunta na naman kami sa Tuesday sa inyo, Doc eh.
Oh, okay.
Sa
So,
Tuesday na naman.
anyway, okay, to summarize, wala nang ibang tanong. Basta ito lang yung basta tandaan niyo turo ni Dr. Oso na pag may bukol, surface lumps, no? Hanapin niyo muna yung signs of inflammation, no? Which consists of kung may nana, sigurado na yan, no? Okay, kung walang nana pa, yung mapula, red. Pag mapula, ha? At masakit, no? Ganon. Huwag kayo masyadong matakot, at least kung may signs of inflammation, hindi yung cancer. No? Bihira yon, no? Kung walang signs of inflammation, ayun, medyo nakakatakot, no? Baka cancer eh, di ba? Okay. But ang approach noon, you look for signs of cancer. Okay? Yung signs of cancer, kaya inuna natin signs of cancer kasi madaling i-recognize. Cancer nag-i-invade. Kinakain yung mga tabi-tabi, di ba? Kinakain niya eh, no? Okay? At hindi siya gumagalaw, pinifix niya, no? Okay? Kung meron yan, mag-suspect siya na kayo ng cancer, no? Okay? Kung meron siyang spread to the lymph nodes, yung sa mga kulani sa tabi-tabi, at kung merong yung isa naman, spread to the, yung pinakamalayong organ, usually hindi pa nakikita yan eh. So, importante yung lymph nodes, no? Kung may lymph nodes, no? Parang yung sa breast, palagi yung kinakapay yung breast sa kilikili ninyo, no? Kung may bukol dito sa breast, tapos may kulani dito sa kilikili nyo, most likely cancer na yon, no? Most likely. Kasi may spread na eh, no? Okay? Then, kung walang signs of malignancy, yon, medyo baka makakahinga kayo ng konti, ay most likely benign ito. Na? All the more, ito yung pisilin, kung may bukol na hindi masakit, pisilin lang nyo, pindutin ninyo, tingnan nyo kung may tubig. Okay? Parang may tubig, no? Most likely hindi siya cancer. No? Ganon. So, ito yung algorithm applicable sa lahat ng bukol sa katawan na surface lumps. Ha? Hindi yung sa loob. Ha? Okay. Ibang approach yung sa loob. Okay? Okay? So, no more questions? We'll call it a day?
Yes, Doctor.
Okay. So, we'll see each other next week. Baka last na next week, tama? Ano bang date next week?
16, Doctor.
Okay, 16. Probably that will be the last for the year. Na? Okay. Hindi ka pa alam anong topic, baka year-end, yung mga dangers of year-end celebration. Okay? Baka yan ang topic ko. Ha? Okay. Okay, if there are no more questions, we'll call it a day. Na? We'll see each other next week. Na? Bye-bye.
Bye-bye, Doc.
Thank you po.
Bye. God bless.
And po.